Welcome to Medicab's PDS Express. In today's class, we'll be discussing one clinical MCQ. So before starting, let me tell you that if you have not subscribed to our YouTube channel, please do subscribe and press the bell icon so that whenever we post any new video, you'll just get notified. So this is a clinical question, and this question has been asked in the year 2019 NEET PG examination. Now the question belongs from periodontics, and the question was a 6-year-old child reported to the OPD with following appearance, and this was the image given, and they were asking the diagnosis. Now in this image you can see that this is the pathology, or you can say that this is the lesion which you need to diagnose, and the options given were cyanosis, pre-eruption cyst, abscess, and angiogranuloma. Now the interesting thing is this age group, 6-year-old child, and the location was anterior region, that is 1-1. Okay, and you can see that all these dentition, all these teeth, they belong to the deciduous dentition, right? So it points out towards the diagnosis of pre-eruption cyst. Now what is pre-eruption cyst? So again in this image you can see the bluish appearance, right? And incisors have not been erupted yet. So pre-eruption cyst, basically it's a benign soft tissue cyst which appears prior to the eruption of the central incisors, and it regresses automatically and you need not to give any sort of treatment, and generally this is asymptomatic unless it is infected and it gets symptomatic. So soft tissue benign cyst accompanying with an erupting primary or permanent teeth. Usually it is associated with the permanent teeth, and that too with the central incisors, right? Now it appears shortly before the appearances of these teeth in the oral cavity, and it is a soft tissue analog of the dentigerous cyst. This is said to be the analog of the dentigerous cyst, but this is not dentigerous cyst. Instead, it is recognized as a separate clinical entity. Now it occurs when the tooth is impeded in its eruption and within the soft tissue overlying the bone. So this is pre-eruption cyst. Now etiology, though it is not quite clear, but Aguilo et al, various authors have conducted different studies, and they stated that various factors are there which predispose to the this pre-eruption cyst. So such things, they are caries can lead to this. Trauma, generally trauma, they say it leads to pre-eruption cyst. Infections and deficient space for the eruption, all these they are said to be the possible factors for these pre-eruption cyst. Now this seems to be arise from the separation of the epithelium from the enamel of the crown of the tooth. That's why we say that it is identical to that of dentigerous cyst. Now due to the accumulation of the fluid or blood in the dilated follicular space. Now if this blood or fluid gets accumulated, basically the blood which gets accumulated in the follicular space, eventually it will give rise to this bluish purple hematoma kind of appearance, right? So age range is 6 to 9 years. That's why I said that pay attention to the age group in the question which they were asking. So a period coinciding with the eruption of the permanent first molar and incisor. Now clinically the lesion appear as circumscribed. You can see the circumscribed lesion. Fluctuant, often translucent swelling of the alveolar ridge over the site of the erupting tooth. And when the circumcoronal cystic cavity, it contains the blood, the swelling will appear purple or deep blue, and in this condition this is known as eruption hematoma. So you need not to confuse with these two terms, pre-eruption cyst and eruption hematoma. If you get short note on this eruption hematoma, you need to write all these points only. Now differential diagnosis for this is hemangioma, neonatal alveolar lymphangioma, pyogenic granuloma, and amalgam tattoo. All these, they are the differential. Now why I'm telling the differential diagnosis, because this is important for Viva. An examiner can ask you the differential diagnosis for pre-eruption cyst. So at least they are expecting 1 or 2 names, and apart from this, short notes can be asked on this pre-eruption cyst, right? Now, if you have not subscribed to our YouTube channel, please do subscribe and press the bell icon so that whenever we post any short concept video or any MCQ discussion, you'll automatically get notified. And apart from this, we are also sharing this short videos and concept on this www.medicoapps.org/groups. Now, in these groups, they are WhatsApp group and they are limited groups. And in this, we are sharing the updates as per your year. Like for first year, we are sharing anatomy, physiology, biochem, concepts, short concept videos and cards. And for second year, we are just posting pathology, pharma, micro, and dental materials, and so on. And for interns, we are just posting the related content. So you can just check out these pages and groups, right? So this was all about the pre-eruption cyst, and again I'm telling questions can be asked. This is important for NEET PG examination as well as for your short notes and for your viva. Hope you have liked the class. Thank you.